Hello again, everyone. This is Brooke Rouse, the Executive Director of the St. Lawrence County Chamber of Commerce. Thank you so much for joining us today. We've been working very hard to keep businesses informed throughout this process, and now with the Phase 1 reopening to start tomorrow, May 15th, we wanted to quickly get some information out to you that will help both the Phase 1 businesses as well as businesses who have been identified in Phase 2, 3, and 4 start to think about ways to prepare for a safe and successful reopening. We've been working very closely with the St. Lawrence County Industrial Development Agency, the SUNY Canton Small Business Development Center, Cornell Cooperative Extension in St. Lawrence County, as well as a number of other economic development partners to work together to make sure we're reaching out to as many of you as possible. And I certainly encourage you to be in touch with us if there's anything else that we can do. We are working with a number of businesses, and between all of us, we can typically help you out, and we will send you in the right direction for the best help available. That can be anything from planning to financial planning to accessing loans and financial opportunities, to just better understanding guidelines or accessing resources. So do not hesitate to be in touch with us. We understand that this situation is a lot on all of you and all of us, and we don't want you to feel alone or that you have nowhere to go. So please, this slide has some of the resources available, and if you're not sure who to contact, just contact any of us and we'll send you in the right direction. And we'll be sending out a PDF at the end of this that has all of the public health contacts as well as the economic development partners so that you can have that easily available. And that's a one-pager of contacts. So we are going to get started. This is being recorded and it will be available on the St. Lawrence County Chamber YouTube channel. We'll send that link out as well as soon as it's available. I'd now like to introduce the Director of Public Health for St. Lawrence County. We're so fortunate to have Dana helping our county through this and leading the way, and really appreciate her time and being with us today. It's always very important to keep in mind that economic development and business, back to business, is our goal, and we want to make sure that we do that safely. And so we thank Dana for being with us today and presenting us with some information to help guide that reopening. Thank you, Dana.
Thanks very much, Brooke, and thanks everyone for your participation. I thought I would start today just giving you an update of kind of where we are. And then I also have just some graphs that shows, where we've been since this has all started. So currently we have 194 as our case count. The last 2 days, we have not had any cases that were reported to the department. And in the last 7 days, the daily average has been 1 case. We put positive cases into the isolation process. And right now we have 152 cases that have been released from isolation. Right now, there are 3 hospitalizations, and I believe during the whole time, we just had a county call right before this call, there have been 34 hospitalizations since we have started. You can see that we've tested just about 4,000 people. And if you, we're gonna talk about testing in just a minute, I believe as well, but we can move to the next slide. And so here again, I kind of mentioned, where we are. We've had 2 deaths. With regard to the case status, we have about 1,000 people who have went through the isolation process or the quarantine process. And so that's where we monitor people who have been positive or who have been a contact to a positive, where we contact them just on a daily basis, and they have to be separated from those who live in their household. Right now, we have about 20 people on isolation, and we have about 250 who are in the quarantine process. We are really still trying to ramp up the testing for this county. And so in the last 2 weeks, there's been new guidance about who can be tested. So as all of this kind of process got started, we didn't have the testing, the capacity, and we have been able to ramp up and make sure that people know that they can be tested. And so when we started, we were really just testing people who had symptoms. And now if you're a healthcare worker or just any other essential worker, you can also be tested. So the phone numbers that you see here for the testing sites, you can call there and you can make an appointment. For St. Lawrence Health Systems and for Claxton, this is a phone number where you have to call for the appointment. They give you that appointment, you drive there, and then they come out just to do the swab for you. For the Clifton Fine Hospital, that is a nursing line, and they will talk to you about symptoms and things like that. And then they can also just do a test as well. Next slide, please. So this kind of shows the cases that we have had since the start. And our first case was on March 25th. And you can see how many new cases we had on a daily basis. And it goes until, I think, Tuesday. And so you can really see where we had a drastic increase and then how now we're down where we're seeing about 1 case per day. Next slide, please. And this is just some of the data that we see on like age groups that we've seen that can be positive. So I think this is always good information to share, because I think when this came out, people felt if that they were younger, that they couldn't get the virus. And we have had a widespread where most people though are between the 21 to 30 age group, and then the 51 to the 70 age group. Next slide, please. The New York State Department of Health does have a tracking website, and so you can go and you can see by county and by state what has been going on. One of the things that we've been working hard on is when we do tests, both of the hospital systems do use a different lab. And so during this time, we have had a hard time making the communication between the labs and the state system where the cases get reported. And that's usually how our department would get that information. But we have a close relationship with both of the labs. So they either fax us or they send us just an email. So we don't have to wait until the case comes through the system. But with the state now reporting 192, and we have that we're at 194, that is just really getting closer. And we've been working hard with the labs to make sure that kind of information is there. And so you can see that it says that we've tested 3,700 people. That's closer to about 4,100, because we are still waiting for some of the tests. So we pushed through the positive tests, but on ones that were negative, we're still waiting for the kind of retrospective data to get entered into the state. Next slide, please. And here is just the metrics that you've been hearing about. So just yesterday, we met all of the metrics so that we can open up. The last two that we were waiting for was the amount of the testing that we can do. So we need to do about 3,000 tests per month. And during the last 2 to 3 weeks, we have met that here in our county. And then for the contact tracers, we need 30 tracers per 100,000. And we have about probably 60 people on our list. So we have some staff that are in our department, and then we have gotten some of the volunteers that have worked in the department, some who are just the other county staff, some who are from the colleges, and from some of the partners. So we have a lot of people who are just really interested in doing the support of this response. Next slide, please.
Dana, before we move on, can you just explain the role of the tracers and what they're doing?
Oh, yeah. So contact tracing. So when we get a new case, we do an interview with that person and we ask everyone who they've been in contact with for a certain time span. And that usually goes from the day that they had the symptoms start, and we look back 2 days from then. So during their asymptomatic period, 2 days before the symptoms started until the day that we're talking to them is the window that we want to know the contacts. And so we ask them, we get a list. Some cases may have none. We've had some cases that have had just quite a few. And so based on the amount of the cases we have per day or how many contacts each case might have really tells the load of how many calls we make. And so we make these calls to ask about their exposure, to ask about just any symptoms they might be having. We do recommend testing on all the contacts that we do talk to, and then we explain the quarantine process. And so that's what the contact tracing is. And so the state does have this kind of requirement that we ramp up because with the reopening, should we have a spike, we just will need to have that assistance so that we can get people in quarantine should we have some positive cases to try to isolate those so we can break that kind of spread from happening.
Thank you for that clarification. I think it's helpful for people to understand that process. And along with that, someone asked that you mentioned 250 people in quarantine. So would those be the ones that were identified through the tracing?
Yes, so that's through all the positive cases. When we do the interview, we get the contact list, and so those are added up, and those are all the current people that are in the quarantine currently. The 1,000 are the people that have either kind of finished that process or they have been done with the isolation process. So the difference between isolation and quarantine, it's the same process, but it's called isolation when you're a positive person, and it's called quarantine when you're a contact to that positive person.
Thank you. That's helpful.
So just yesterday, so we haven't just really gotten a lot of guidance on what the reopening means and what that's going to entail. We do know that it's going to be a phased process. We are kind of waiting for new executive orders to just come out to explain what's going to be the restrictions, what we can and can't do. So there are still a lot of things that we're kind of waiting just to hear. But last night, the website was kind of updated. And so it does give you some information by phase. So it does talk about who is going to be in what phases. So you can see there on the screen. And then because we're in phase 1, it goes by each of the 4 areas. So construction, manufacturing, retail, which is curbside, the agriculture, and fishing. And what it does very nicely is it kind of separates these 4 areas. It does give you the guidelines. It does give you a template for what should be in place. So it talks about people, space, activities, just all of those policies that would be helpful to have in place. And are you pulling up one of the templates?
Yeah. This is the guideline. This is the guideline sheet.
So it just shows you what has to be in place and then what is best practice. So that's really helpful. It talks about hygiene, social distancing. Yeah. And then this is kind of all of the guidance for the specific sector. And so you can read it and then you can make an affirmation that you have read it. And then it asks that you just keep it on file so that if the county came to you and asked to see your plan, you would show that you did an affirmation and things like that. So these are all there for you on the website.
And the affirmation, it clicks into a form, just so you know, some people had asked how that gets sent into the state. It does click into a form that you just confirm that you've read it, and then there it is right there. And then you can keep it on file, as Dana mentioned.
And so I believe as we get into other phases, there'll be more detailed information for those businesses that will fall as time goes. And so this is the template, and it's really nice. It has lots of questions that you can be thinking about. So some check boxes that you can do. So with the distancing policies. Then it has some questions that you can ask yourself as well, so you can be kind of thoughtful on what might be working, what's not working so well, and things like that. And then it goes into hygiene and the cleaning and the disinfection, how you're going to make sure to post all of the signage so people know what's going on, and then all of the communication you'll have with employees when things change, what needs to be updated. It does give information about doing screening. And so this is to do a health screening for employees, and how you can do that, how you can keep yourself safe during or doing that screening. And so that's really what the template entails. So I believe there's a template for each of the 4 areas that's going to be opening. I looked through them quickly. It looks like they're fairly similar, but between. So most of the guidelines are the same. You'll just have to kind of make them be appropriate for your type of business, the type of activities that you do. And I see that there's a question of how to get a copy of these forms. So you can go to the New York State, the Department of Health website. And if you put in reopening, you'll see that there's a plan, and you can just click on all that. And that's where you'll see the sections on all of the phases. Oh, and you have the website right there. So it's the_New_York or ny.gov. Okay. So that's that website, and that was just kind of brought online last night. So before I knew that that was kind of coming on, I started thinking about, well, what kinds of things do people have to have in place? And so these 8 criteria were the first things that the governor mentioned. And so I'm going to just briefly go through these things just to give you some of the examples of what you could do. They're not kind of all inclusive. And the resources that I used for trying to give the examples is going to be the New York State website that we just looked at. And then also the CDC has a nice kind of write-up for the guidances for the reopening. So I will make sure that, Brooke, you have a copy of that, and then that you can post that as well.
Yes, and just so everybody knows, I will put a couple links in the chat here, but we each, the St. Lawrence County Public Health has a website, and they'll be updating. All this information became available last night, so they'll be updating on their website. We also have in that initial slide and at the end slide links to visit STLC /COVID-19, and everything will be there as well. The IDA also has a page with resources. So we will keep links as they're updated available on those sites as well.
So for the first criteria, trying to really look at who needs to be in the office at the workspace as we try to reopen. So really still looking at how can you change shifts, how can you look at the hours that people are at work or the hours that you're open, can you stagger, Can you still have some people work from home? When can you do like a teleconference? And if not, how can you seat people just in a room or keep the numbers down, making sure that you have good ventilation in the room. Just as it becomes warmer, we may be able to open the windows, and then making sure that we're still all wearing masks. So I think it's really important to just think about that as we reopen, things are not going back to how they were prior to this starting yet. So we're still going to have a lot of things in place, and mask wearing will be kind of a standard. And then really trying to look at accessing those kind of common areas so that you can kind of limit how much of the gathering can occur. So that will be important. So those are some of the concepts just for that first criteria.
Dana, there was a question on this specifically. Has there been any guidance yet on the percentage of returning to work? I know when we closed, it was 50%, 75%, 100% out of work. Is there anything in place that you know of right now? I haven't seen it saying in phase 1 and phase 2 and phase 3 or time-wise as far as going back down from 100% out, 75, 50 back to full workforce. Have you seen that, or is that guidance available yet?
I have not seen that guidance. As far as I know, it's still 100% or 0% for most businesses. It's at the 50% for the governmental, and then the essential can be 100% if it has that kind of designation. But yeah, that's one of the things that we're kind of waiting to see if that's going to happen for tomorrow.
So if a business is within phase 1 to reopen, they have the ability to return at 100% workforce?
I believe that's how it's going to be, but I'm not quite sure, and we'll have to wait to see what's going to be written in that. Yep.
Okay, and I think from this slide here, as well as in the information that the state has just released, it does encourage continuing to keep that distancing in the workplace. So I guess
Yes.
it's per business. If you can have everybody there with enough distance, then it's all right. But if not, you'll have to shift work or make different plans, it sounds like.
Yep, and I think there's two pieces to that. So I think there's a distance piece, which we'll talk about next, but it's also kind of the density piece, which is what we just kind of explained. So if you can really try to spread out work shifts so that you don't have people all kind of on top of each other, I still think that that's the best thing to do. And these examples can kind of help you with those things. So with the social distancing, so it's always at least 6 feet apart. So it's whether you can space your desks, your workstations, thinking about how you can move furniture, how you can change the flow through an office or through an area so that you have people come in one side and then out just on another. If you can have that kind of one-way zone so that you don't have to be passing people, that can be helpful. Thinking about some of the barriers that you can put up, some of the plexiglass, things like that. How you're going to designate with signs or tapes so people know to keep their distance. And then thinking about just the practices that you can change. And so do you need to have the face-to-face contact? And then thinking about how you prioritize the activities that do happen during the day. So if there's certain things that you can happen when you don't have customers, just there, what you can do so that you can try to just decrease the exposure that people have. And then for the non-essential travel, this can be both for work and for non-work types of the travel. So really looking at for work, what do you need to travel for, and what can you kind of postpone? Can you do a meeting just in another mode? Can it be a video conference? And then really talking to your employees about where they're going when they're not at work, because if you're traveling out of the county and then you come back and you may have been in an area that has a higher transmission. And as we go through the reopening stages for the state, we just have to be thoughtful about what's going to be going on here in our county, but throughout the state. And so just be thinking about that, because there is times when people do travel that we do kind of recommend that self-isolation, just to be sure that you can do the self-monitoring of your symptoms to make sure that you're still healthy. So like I said before, masks and the appropriate kind of PPE are going to be important, both for the employees and for customers. You do need to make sure that they can be cleaned or replaced, because if you use them for too long, they won't be beneficial. It's important too that you instruct people how to take them on and off, that you're not touching them all the time, you're not touching your face, which, you know, when you do wear a mask, you do want to touch your face just more often. So just be thinking about that. And then kind of do an assessment of what is the PPE that's kind of necessary for the activity, and make sure that you have all of that in place. And then make sure, just like masks, that you train people, or if it is an N95, so if you have to have a fit test done, that you have all of those things in place so that people are kind of, you know, just ready to do the job and to do the interaction with the public. Cleaning standards. So there is a lot of guidance on that, and I can provide that to you, Brooke, too. So CDC, well, actually, so the New York State website has a lot of the cleaning recommendations by sector. So it goes by church, by school, by college. There's just many kind of different breakdowns. But here just really talks about making sure you have soap and water for people to wash their hands. When that can't be available, that you do have a hand sanitizer, that you do have stations that people can clean their hands on a regular basis, that you do both the cleaning and the disinfection of things that are used quite frequently and that may be shared. So first you want to clean something, then you want to do the disinfection, and that makes it the disinfection process work better when you're not doing it on a dirty surface. There is guidance on the New York State Department of Health's website for what products that you can use so that it will fight against the virus. And then making sure that you have just the proper PPE when you are doing the cleaning as well. So health screenings is something that should be done. So really looking at taking temperatures to see if people just have a fever, and then asking about the main symptoms of the virus. So for cough, shortness of breath, aches and pains, if they have a headache, if they have abdominal pain, loss of taste and smell has been one of the symptoms that we probably see in at least 25% of the cases. Making sure that you know the status of the employees, knowing if they have a sick family member so that you can kind of follow that, and knowing if they are a contact to someone who is sick or a contact to someone who is positive, because those are both kind of very different. Making sure to have a place that people can go if they start to feel sick at work, and a process for how they're going to get home. And then just having some kind of flexibility for sick leave as we kind of work through this process. And then also knowing when it may be appropriate to ask somebody just to get a test and to help them to get that referral. So just many times we have a case, it does involve an agency, which can be very helpful. So most times when we do that interview with the positive case, we're asking that one person to try to remember all of the contacts that they would have had. when we can also involve the employer, like we can get the work schedule, we can know who was on the shift for a day, that can be very helpful. And that kind of adds to making sure that we have just all of the contacts that we can. And so it's just really important that you can work with us and make sure to let us know if you know of someone who has had a positive test, and then have the employees make sure that they tell you what their status is and kind of what's going on so that they can stay home and that they don't bring it to work as well. One of the most important pieces, and I think from kind of when all of this started, we really talked about how important it was to wash your hands, to cough into your elbow, to clean and disinfect, to stay home when you're sick, to do the social distancing, to not travel when you didn't need to. All of those things are still going to be so important, and it's going to be really important now as we try to kind of reintroduce just all of us to the public spaces. So I can't say enough, all of those things that we've been talking about so much as time kind of went on, and we've gotten now more into mask wearing and to the social distancing, those things, plus all of the things that we've always been saying are so important. So if you can get the signage and you can remind people just on a regular basis, that's going to be very important.
And we will provide the links. The CDC and the state both have very nice posters that you can just print there, or you can contact one of our local printers if you want to have them printed as well. So we will make those available. Some are already on our websites.
So this is just an example of a tracking log that you could use to keep track of the employee's health status. It's recommended that you do it at the beginning and at the end of the day. And so you can just, keep track, and so that you can kind of be, just monitoring and know the status of each employee so that you can be on top of things should something start. And that's one of the hard things, about the coronavirus is there's just so many people who can be asymptomatic the whole time. So they may be a contact and they never have symptoms. We ask them to go get a test. If they get tested, they find out that they are positive and they still just never have the symptoms. And so that's really one of the difficult things about it, is because people don't know when they're sick. And then sometimes that makes it even harder to explain why it's so important that they do the isolation process, or that we do wear a mask, because it's when we wear a mask, we are just trying to do the protection of those people around us. And when we stay home, it's so that we don't spread that. But when you don't have symptoms, then it's really hard, to understand how important that might be.
We'll make this template available too, so that you can utilize it in your workplace if that's helpful. Dana, just on this point, there's a good question about, are there HIPAA laws that businesses need to be aware of while they're collecting this information and or sharing it if public health contacts them? Is that something they should be concerned about, or have employees sign something that the information will be asked and reported on?
I'm not aware of that. Let me check into that for you. I know when you do these kind of screenings, you should, do it. You should have an area where it's not a group of people. You do need to be aware of the protection yourself of those people doing the screenings, making sure to keep the distance. But you should be doing it more in an off kind of side area too. But let me check into that.
Thank you.
And so, like I mentioned, there are many resources out there from the CDC, from the Department of Health, and from the New York State, from the governor's website. And so most of the things that just all of the things that I've pulled from do come from the CDC and from the State Department of Health. And so there are lots of things that you don't have to recreate. And if you have any questions of where we got something, or you want a resource for something that you can't find, you can always contact us. So this is the guidance that I was talking about from the CDC. And so this is about a 9-page a document that goes through all of the things that we've just talked about. So both the state and the CDC kind of lay it out very similarly. And so it's just kind of nice to flip back and forth between the two. You'll see that they're just slightly different, and you know, each kind of business will have their own needs. And so you'll just have to kind of read through it and see what's going to work just the best for your situation. This is on the New York State website. So this is what they put out talking about where we're going forward. It does mention the phases and where we would like to be. And so this can be a very helpful document as well. This is the guidance for the cleaning and the disinfection. So I also mentioned that there is some of the sector specific ones. This is more general. The one there on the left helps you to make a plan for what you're going to do and what you're going to need. And then the other one is more of just kind of a checklist for what should be there. Here are some of the posters. So this is a good one of just to put up for your employees, for customers, just to remind them how to stay healthy. So this is just the top of that poster. I think it does go through hand washing, all of the hygiene stuff, cleaning, but it just, in a nice kind of brief way, gives all of the points that you want to get out to people. This is on the cloth masks, and so this will be something that will be still recommending that we all do. So these two talk about how to make sure that you have it on in the right way, that it fits properly, that you're washing it, and all of those things. There is also another CDC website. You know, we have a lot of masks from the EOC that if you're in need of some, you can call the EOC, but there is a way that you can make them at home very easily. And so there's great resources on mask wearing. And just to keep in mind, when you're wearing a mask, we still need to do the social distancing, and it doesn't make it so you're 100% in the clear. It's just one more thing that we're kind of adding to all of the recommendations just to keep us as healthy as possible. But no one thing by itself is going to be 100%. There's some really nice hand washing posters. You can print them. I think you can order them from the CDC and from the State Department of Health. And so they have very simple ones with just pictures. I always try to think about who's going to be reading posters and what they say, so that they're new, or that they're not too complicated. So these can be really helpful. Okay, Brooke, I think this is you.
Yeah. Thank you, Dana. That was really helpful. We do have questions coming in, and if people want to continue to add their questions, we'll go through them. I'll preface the Q&A by saying that Dana is not necessarily savvy on all of the specific guidance within each of the phases that's coming down from the state, but so I'll ask some of those questions, but a lot of that I think is unknown to us right now. We don't have a state rep on the call, but we are in touch with them, and we can get answers as much as possible after this too. So I just wanted to add just a couple of things in the idea of reopening, ways that you can be promoting your business. Some seem common sense, but in the the craziness of things, sometimes we forget, but just make sure that you're keeping your website, social media, and your online Google listings and things like that updated with your hours and any new procedures. Those, the online listings now have little tabs you can click for takeout or curbside or anything like that. So that is a really good resource to make sure you're communicating. If you're closed now or you're open in different phases yourself, you as a business can choose how you want to open and or pull back at different times. So just try to keep your customers updated on that. Certainly post frequently on social media. There's a lot being buried on social media, so continue to post multiple times a day to keep your businesses informed of what you are doing to keep them safe and what you have available for them. A lot of people are trying to support local, so if they know about it, they can help you out. Be in touch with your customers, call, or if you have an email ability to blast to them to keep them updated. It's a really good way to keep communication going with your customers. You want to promote and or create ways to allow people to order online and keep kind of contactless purchasing. And this goes for businesses that are currently open, but those who open throughout the phases, you're going to want to maintain a level of safety as long as possible. And so getting these things in order to allow people to order online or just pay over the phone or whatever the case may be. And we do have resources through the chamber and through a program with ANCA to help with some e-commerce, as well as the Small Business Development Center. So we're happy to help with that if you don't have something in place. Typical forms of marketing, get in touch with local news and radio, see what they can do to help get the word out. A lot of them are offering discounted opportunities to help businesses and help them as well. They are local businesses. And keep your voicemail updated. Some people kind of left the office and voicemails are now full. Make sure you clean those out, keep them cleaned out, and that your voicemail message is informative as well, so that if you can't answer every call, they know what your hours are, what your status is, and what your procedures are. Those are just some tips to help you successfully reopen. And likewise, I think as business owners, we need to continue to support other local businesses and spread the word of how people can support local business. And a lot of that's been going around, but just a couple of reminders. We really need to encourage our customers to continue to wear a mask and practice social distancing in our businesses. I know there's some concern from people about if they're allowed to open and they do open, and then customers are choosing not to wear a mask but still want to enter your business. It puts a business owner in a tricky situation. So let's all collaboratively try to encourage the public to continue to wear a mask and respect whatever it is the business owner decides to have in place to protect their employees. Be aware of business decisions for operation and respect that, just to that point. If they're requiring whatever they're requiring, just respect that. Buy local. Certainly, as you're starting to get your business back open, you might be buying supplies or setting new things up. You may be investing in different marketing pieces. Certainly, you as a business, try to keep those dollars local, support the businesses here who can support your reopening, and then encourage that with others. You yourself can order takeout and curbside, and we can encourage that. We have on the Visit STLC site a takeout site with who is currently making that available. If any of you want to be added to that, you can do that. The email is on there. So that's Visit STLC/takeout. We also have a curbside page as well. So as you open up curbside, we can add you to that list as well. And we're hearing from businesses, the more advance notice you can give. So if you're ordering takeout and you know you're going to do it tomorrow, call today, let them know, or give a few hours advance notice so that they can manage their staff. A lot of them will still be operating under limited staff. So that's good. And you as businesses, if you're doing takeout or curbside, make that clear in your procedures too, that as much notice as possible is helpful. And share other business posts on social media. As I said before, to promote your own business, it's good to post a lot, but sharing your visit at businesses or your purchase or their posts is really helpful. Again, more than ever, we really want to encourage supporting local businesses among ourselves and to those who don't own businesses. So they're just some reminders there. And I'll just put this up as we get to some of the question and answer. Some of the resource partners are on the line here. You can unmute yourself if you're a resource partner, but anyone else who has a question, if you can punch it into the chat, that would be great. We're going to try to finish up by 1, so we'll just get through a couple of these questions and then we will follow up with anybody else. So Dana, some of these, I'll start with you on some of the kind of public health related things. Can you talk about the antibody testing, the difference between the antibody testing and the kind of the regular COVID-19 testing, and if that antibody test is available, and also maybe some misconceptions people have about the antibody test, meaning that you're in the clear if you've had it. Just trying to oops, sorry, Dana, I muted you again. Dana, you can unmute yourself. I think we were clicking it at the same time. There you go, Dana.
Okay.
Sorry.
Sorry. Yeah, so the difference between the two tests are the PCR or the nasal swab is what's going to tell you if you're positive for the coronavirus right now. And so there is a 14-day window for the incubation period. So if you were kind of early on in that window, if you were on day 2 or day 3 and you get tested, you could still show negative and you could be positive those next few days. Or you could get a test one day but have an exposure the following day, and that test that you had previously, would not show that. So that's just something to keep in mind with the nasal swab and if you're currently positive. So if you get a test, it's going to tell you if you're positive on that day. The antigen testing is to find out if you have the antibodies, so if you've been exposed previously. So that could mean that it was a few months ago, it could mean that it was this week, it could mean that you're currently positive. So you don't actually know when you were exposed. It would just tell you if you had that exposure. There was a lot of enthusiasm for the test because people thought, I'm going to find out if I have the antibody, and then if I do, I can just kind of do whatever because I won't be able to get the coronavirus again. And we're not actually sure if that's true. There's not enough research out. There is some of the evidence that does say that you could be reinfected. And so if you want to get an antigen test, I think the best reason to get that test is just to know if you've been exposed in the past. And we've had some people that have said, gosh, I think 2 months ago, I felt like this, and I'm just kind of wondering. Now, to get that test done, you need a doctor's order from your primary care. That is a blood test. So that doesn't usually happen on the same day because it's not the same type of a method. If you do go for the PCR test or the nasal swab, there are the phone lines that I mentioned you can call. They'll set an appointment. That's where you drive up. Then they give you a phone number to call. So they come out to your car. When you're there, they swab you, and then you're done. So those are really kind of how they are just different tests.
Thank you, Dana. There are several questions about when certain types of businesses, what they fall into. I think the state released last night, or the state released a couple of days ago, who more specifically under those under the phase one businesses, the types of businesses under those. But for future phases, those haven't yet been clarified. Dana, I don't know if you have any further information, but I think we all need to just wait, and the state is working on defining those more, and that will become available on the NY Forward site. Is that your understanding?
Yeah, I think those categories are quite broad. For the professional services, I'm kind of thinking of that as kind of anyone who has a license to practice, but I'm not sure that that's true. That's kind of how I see it. So yeah, I think we do need to wait for more information. As you can see, last night they did provide quite a bit of detail in these four areas, but we didn't have much timeline on that. So yeah, I think we do need to wait.
Okay. And there is a place on that website as well where you can inquire about anything specific. So feel free to type that in. I think ESD is working hard to get back to people. And if nothing else, it will let them know that that needs to be clarified for the future. So certainly put in your request on the ESD site for more information on that. There's also a question about, it sounds like a maybe manufacturing facility, but I think from manufacturing to whatever type of business, if you find yourself in a situation where you can't operate under the guidelines presented using social distancing and masks and things like that in order to operate, do you have any advice for that?
Well, I guess you could reach out for assistance on why that's not able to be happening. So maybe we can think of some alternative ways. You could think of alternative practices and ways to get your business out there. And then I think too, you could probably put a question into the state for the ESD as well. But I think trying to get some consultation on how we could make some changes or things that you could do so that could be happen would be the first thing that I would try.
Great, and I will point out on the screen right now, the St. Lawrence County Industrial Development Agency, as well as SciTech, work very closely, especially with manufacturing industry, and they've been able to pull several samples of how facilities are operating, and they can also assist with getting more specific recommendations and the materials to help you be successful and be safe in your facility. So please write down those numbers if you're not already in touch with them, and they can kind of handhold you through that process. That's a great resource. On the state website, the information that came out last night also provides, we kind of quickly scan through, but under manufacturing or the different areas that are able to reopen, those guidelines under each are specific to that industry. And then the plan template associated with each of them also, as Dana pointed out, it asks you questions throughout that as you're planning. And so the piece on manufacturing, if that is what this person is asking about, should also help with some of that guidance. But the key is really making sure that your staff and your organization are safe. Just moving through some more questions. Yes, this recording will be available, and we will send out links, and we'll also be updating the Visit STLC COVID page. Someone asked if your help is contracted rather than being an employee, what can you do to kind of manage the contractor? They're an independent contractor, but they're interacting with your business.
Is that a question for me, or do you have an answer to that?
Yeah, I was gonna say I could probably answer that a little bit, but if you have anything else, I think the idea is with any liability in business and in managing contractors, you're somewhat liable for them in how they interact with your space or your staff or your customers. So I think in your plan, just being really mindful um, of communicating your expectations with your contractors or your suppliers or whoever to keep your business safe would be a recommendation.
Yeah, and I was just going to say you could probably, ask for what they're doing for the response and make sure it's going to be just like in alignment with what you're doing, and just make sure that that's still the arrangement that you want to have too.
Great. Someone did respond that they checked with their healthcare consultant, and she assured them that it was not a HIPAA violation to get this information from your employees. So that's good. We have quite a few more questions, but I'm going to just maybe tackle two more. One question for you, Dana. Since transmission is often spread asymptomatically, why is temperature taking still required? I know some businesses, that's been their standard. They take temperature as people arrive, or daycares or things like that. Um, is that is temperature something that precedes or is still there when other symptoms may not be?
Well, so temperature is one of the main ones. It's not in all of the cases. And actually, what we found in many of the cases when we talk to those who are positive, temperature might be high, but not what we normally consider to be a fever. So we have a lot of people who kind of run in the 99s, which is high, but usually it's about 100.4 before we call it a fever. And so I think it's just something to kind of keep in mind that you got to know someone's baseline temperature as well. But if you're someone who runs kind of normal and you're starting to rise, it would just be something that you'd want to be monitoring.
Okay. And they just followed up with they don't have the non-contact thermometer. Not sure if they can even get them. They're probably hard to find. I would certainly recommend getting in touch with local pharmacies and things like that to see if you can get them. And I'm sure it's something that everyone's trying to restock.
Yep.
Just trying to get through. Again, the phases will be a state question. We'll just keep updating as more information becomes available from the state.
Yeah,
And
as far as how we advance to the phases, I know there's going to be a reassessment like every 2 weeks, and it's going to be those the control rooms for the regions that will be trying to monitor the criteria to see where we are, and so they'll make the decision on whether at that mark we can move forward or not. And so I'm thinking the criteria to move forward will be all of the same that we had for the reopening, but there hasn't been a lot of guidance on what the markers or what the thresholds are going to be, if they're going to stay the same, and things like that. So those are the things that we're still trying to wait to hear about.
and I don't believe it's been confirmed that there's a strict 14-day waiting period between phases, or is that your understanding that it's 14 days and it will be reassessed at 14 days? What do you
I,
see as the timeline?
I think you're right. I don't think it's a strict, it could be just less than 2 weeks. I know there is going to be some time. I haven't heard exactly what that time span is, but yeah, there's going to be a period of, about 2 weeks, kind of give or take. And then, yeah, and then it's going to be just dependent on whether the criteria are met.
Okay, that is very helpful. Um, I know, again, the phased questions, we don't have any more information on. There's questions about spas and salons and things like that. Some understand it to be in phase 2 under professional services, but we don't have that confirmation from the state. Is that correct, Dana?
Right. Yeah, that's where I would see it based on it saying the professional services and with licensing, but you're right, I'm not sure.
Okay. And guidance on large events, recreation, outdoor activities. Do we
Yeah,
have any?
so unless we get a new executive order that addresses something new, I was talking with Ruth Doyle and some people who have been on the control center calls. And so we believe that it's still going to be 10 people until the next the executive order is provided. So at this time, we don't have any new information that gatherings should be larger, sorry.
Okay. And in that case, and that goes for socializing as well, it's still being recommended not to socialize outside of your home, or has that been expanded to 10 people?
That we have had no new guidance on. So far, there has been no new guidance. So what we have is what we have.
Okay. Continue to practice as much social distancing and wearing masks and hand washing as much as possible, I think is where we are at. I think this is an important question, and then we will wrap it up. What do you do if anyone refuses to wear a mask? So if a customer comes in or an employee refuses to wear a mask.
Well, so right now there is executive order. I'm having difficulty remembering the number. Is it 202.16 and 202.17? I believe were for employees and for the public. So we'll have to wait to see if those get extended or if they get changed. But right now, that is the guidance. So I think you could ask, someone to please put the mask on.
Yeah, and I think that's where the signage comes in too, kind of overdoing the signage to make it very clear what your expectations as a business are. And that's where we really hope the public will respect these things, but that will be tricky.
Yes.
Was there anything else, Dana, that we didn't talk about that you wanted to mention to anyone?
No, I just wanted, I know you said it at the beginning, but we did do a two-pager that will have most of the resources that we talked about during this call. So on the back page of it will be resources. We'll have all of the phone numbers kind of on the business side and on the public health side. And then it'll have links as well for the testing, for some of the posters and all of that. And then on the front side of that, we're going to do an update each week so you can see where our case status is, where our testing status is, and just how many people we have in the isolation and quarantine process. And then we'll also put a small map like we usually show on Facebook that does show what our case counts are just in the different townships. So that will help you to see kind of what's going on with the status wise, but on the back side of that, that will list all of the resources as well.
Great. Thank you so much, Dana. We really appreciate your time and all the work you're doing to keep our county safe and keep everyone informed. It's a lot of information for all of us to handle and keep on top of, so we really appreciate the work that you and your team are doing. We're very fortunate to have great leadership in our elected officials too, who are working their very hardest to keep our county safe. And so as business owners and community members, we will also work hard to listen and respect the recommendations provided so that we can continue to reopen safely and successfully. And I just wanted to say, again, on behalf of the St. Lawrence County Chamber, thank you to you. Thank you all for joining us. And please get in touch with the resources available. The St. Lawrence County IDA is also available to help if you have specific questions with Empire State Development about where you sit in phases or how you can plan and proceed. You can get in touch with them. The Small Business Development Center also has counselors available. They're all working remotely and they're going to be increasing staff as well. They can also help with creating those plans. And I would certainly recommend that although the plans have been released for those phase one businesses that if you want to go and have a look at those to see if you kind of relate in any way to any of those and start putting into place those procedures to open safely, then you'll be in a better place if you are in phase 2 and if that phase 2 does happen in 2 weeks. So those are just some recommendations. We also have a toolkit on our website, the Visit STLC /COVID-19, and that gives further information. We'll continue to update that page with some general guidance per industry, knowing that the state will continue to release their information, but we are gathering industry-specific information that we can provide just as guidance for people to start to get organized and plan for a slow and safe reopening. So again, thank you all. This will be made available and we will email out the resources that we have mentioned here today, whether it's links or attachments, and we will try to keep you all updated. Thank you and have a great afternoon, and good luck if you're reopening in the next few days, and if you're out participating and supporting local businesses, be sure to respect and appreciate their reopening as well. Thank you all and have a good afternoon.